Diagnostic and Descriptive Terminology, Understanding Skin and Mucosal Lesions. When it comes to understanding skin and mucosal conditions, having knowledge of diagnostic and descriptive terminology is essential. This presentation aims to provide an overview of commonly used terms related to various types of skin and mucosal lesions. It is important to remember that a professional medical evaluation is crucial for accurate diagnosis and appropriate management of these conditions. Macule. A macule refers to a small, localized area on the skin or mucosa that displays a distinct color. It is typically less than 1 centimeter in diameter and appears flat. Macules can have different colors. They may indicate normal conditions, variations of normal, or the presence of local/systemic diseases. Patch. A patch is larger than a macule and can be distinguished from the surrounding skin or mucosa by differences in color or texture. Similar to macules, patches do not have an elevated or depressed appearance. Lichen planus. Mucus patches of secondary syphilis and snuff dippers patches can manifest as patches on the skin or mucosa. Erosion. An erosion refers to a shallow lesion where the skin or mucosa is denuded, resulting in the loss of a few layers of the epithelium. Erosions are moist, slightly depressed, and often occur due to vesicle rupture, epithelial breakdown, or trauma. Healing of erosions generally does not lead to scarring. Diseases that can cause erosions include pemphigus, erosive lichen planus, and erythema multiforme. Ulcer. An ulcer is a deeper, crater-like lesion. It describes an uncovered wound with gradual tissue disintegration and necrosis. Ulcers extend into the dermis and can result in scarring upon healing. Various factors can cause ulcers, including trauma, aphthous stomatitis, viral infections, cancer, or granulomatous disease. Wheal. A wheal is a raised area of localized tissue swelling or edema. This occurs due to the acute extravasation of serum into the superficial dermis. Wheals are generally pale red, pruritic, itchy, and of short duration. They develop from histamine release of mast cells or activation of the complement cascade. Wheals are commonly seen in allergic reaction that develops shortly after insect bites, consuming specific foods, or experiencing mechanical irritation. Scar. A scar refers to a permanent mark or cicatrix that remains after a wound has healed. Scars are visible indications of wound repair and indicate a previous disruption in the integrity of the epidermis and dermis, followed by the healing of epithelium with fibrous, collagen-connective tissue. Scars are less frequently found in the oral cavity compared to the skin. Fissure. A fissure is a normal or abnormal linear cleft in the epidermis and commonly affects the tongue, lips, and perioral tissues. The presence of a fissure can indicate a condition representing a variation of normal or a disease. Disease-associated fissures occur when pathogenic organisms infect a fissure, leading to pain, ulceration, and inflammation. Fissured tongue is an example of a variation of normal. Sinus. Sinus can have two meanings. Firstly, it refers to a normal recess or cavity, such as the frontal or maxillary sinus. Secondly, it describes an abnormal dilated tract, channel, or fistula that connects a suppurative cavity, cyst, or abscess to the surface of the epidermis. An abscessed tooth can produce a sinus tract that extends from the infected root apex to a clinically visible purulus, which represents the sinus opening. Papule. A papule is a small, solid, elevated lesion or structure that measures less than 1 centimeter in diameter. Papules can have various colors and textures and may arise due to inflammation, infection, or neoplastic processes. Examples of papules include elevated moles, skin tags, warts, and insect bites. Plaque. A plaque is a flat, solid, raised area that measures larger than 1 centimeter in diameter. Plaques typically have a broad, elevated, and plateau-like appearance compared to papules. They can be associated with a range of conditions, including psoriasis, seborrheic keratosis, and some types of oral mucosal lesions. Nodule. A nodule refers to a solid and raised lump or mass of tissue that extends deeper into the dermis or subcutaneous tissue. Nodules can vary in size and may be palpable or visible. They can be caused by various processes, such as infections, neoplasms, and granulomatous conditions. Examples of nodules include lipomas, dermatofibromas, and certain types of oral mucosal lesions. Tumor. A tumor is a general term that describes a solid mass of abnormal tissue growth. Tumors can be benign or malignant. Benign tumors usually have well-defined borders and do not invade surrounding tissues or spread to distant sites. Malignant tumors, on the other hand, have the potential to invade nearby tissues and metastasize to distant organs. Biopsy and histopathological examination are typically required to differentiate between benign and malignant tumors. Vesicle. A vesicle is a small, fluid-filled blister in the skin or mucosa that measures less than 1 centimeter in diameter. Vesicles are characterized by a thin roof and clear or translucent contents. They can occur due to various conditions, including infections, example, herpes simplex, varicella zoster, autoimmune diseases, example, pemphigus, and allergic reactions. Pustule. A pustule is a circumscribed elevation filled with pus, which is a viscous fluid composed of inflammatory cells, microorganisms, and tissue debris. Pustules are often associated with infections, such as folliculitis, acne, or impetigo. They can also develop in autoimmune conditions like pustular psoriasis or as a result of insect bites. Bulla. A bulla is a fluid-filled blister that measures greater than 1 centimeter in diameter. Bullae have similar characteristics to vesicles but are larger in size. They can arise from various causes, including burns, pemphigoid disorders, and bullous impetigo. Cyst. A cyst is a closed sac lined by epithelium that contains fluid, semi-solid material, or gas. Cysts can develop in various locations, including the dermis, subcutaneous tissue, and bone. They can be congenital or acquired and often require surgical removal for complete resolution. Normal. The term normal refers to an anatomic site or tissue that lacks significant deviation from the average or standard appearance. Normal variations can exist among individuals. And understanding the range of normal findings is crucial for accurate diagnosis and recognition of pathological changes. Hypertrophy and atrophy. Hypertrophy refers to the progressive degeneration or decrease in the size of an organ or tissue due to a reduction in cell size or number. Atrophy specifically refers to the decrease in size of cells, resulting in a reduction in the size of the organ or tissue as a whole. They can occur as a result of aging, disuse, denervation, inadequate blood supply, or hormonal changes. Hypertrophy. Hypertrophy is the increase in the size of an organ or tissue due to an increase in the size or number of cells. It can be a physiological adaptation, such as the hypertrophy of skeletal muscles with exercise, or a pathological process, such as the hypertrophy of the heart in response to chronic hypertension or valvular disease. Hyperplasia. Hyperplasia refers to an increase in the number of cells in an organ or tissue, leading to an overall increase in its size. It can occur in response to physiological stimuli, such as the proliferation of endometrial cells during the menstrual cycle, or as a pathological response, such as the hyperplasia of breast tissue in certain hormone-related conditions. Dysplasia. Dysplasia is a term used to describe the abnormal growth and maturation of cells within a tissue. It is often associated with precancerous or potentially cancerous conditions. Dysplastic cells show alterations in their size, shape, and organization compared to normal cells. Regular monitoring and further evaluation are usually required to assess the risk of progression to malignancy. Metaplasia. Metaplasia is a reversible cellular adaptation in which one mature cell type is replaced by another mature cell type. It is a response to chronic irritation or inflammation and is aimed at providing better protection or function. However, metaplastic changes can increase the risk of subsequent cellular abnormalities or neoplastic transformation. Dysplasia. Dysplasia means disordered growth and loss of the normal maturation of cells. Dysplasia implies an alteration in the size, shape, and architectural organization of adult cells in tissue. These changes are often considered premalignant. However, dysplasia does not necessarily progress to cancer. The specific cellular changes include 1. An expansion of immature cells that display prominent nucleoli. Nuclear pleomorphism, hyperchromatic nuclei that are abnormally large or the size of the cell, increased and abnormal mitosis, multinucleation, and 2. A decrease in the number and location of mature cells. Carcinoma. Carcinoma is a malignant neoplasm made up of epithelial cells that can infiltrate the surrounding tissues and give rise to metastases. The malignant changes include increased cell numbers, variable cell size and shape, and abnormal cell architecture. The most common type of carcinoma is squamous cell carcinoma. Other types include verrucous carcinoma, often seen on the gingiva, mucoepidermoid carcinoma, occurring in the major and accessory salivary glands, and adenocarcinomas as observed in the maxillary sinus mucous lining. Basal cell carcinomas develop in the skin of the face and are locally destructive but do not metastasize. These are some commonly used diagnostic and descriptive terminology related to skin and mucosal lesions.